Hi everyone, welcome to week number 6. So this week is going to be one of those weeks where I think you might actually be happy at the end of the week and not really mad at me because I make you do a lot of assignments. But I'm going to keep that until the end of the video. I really want you to get some information out of me first for the chapters before I'm going to tell you what the good news for the week is. So this week is dealing with chapter 53 and chapter 54. So I'm going to talk about those kind of separately because it's easier that way. So chapter 53 is really dealing with pharmacology and medication dosages and how to calculate medication dosages. It's really important for you as a medical assistant to understand how to correctly do the math calculations and the dose requirements because a simple error could lead to a very detrimental accident. An overdose or an underdose can lead to the death of a patient, and we don't want that. So I'm going to teach you how to calculate the medications properly. So there are two methods that we use for weights and measurements to calculate the medication dosage. That's the apothecary method and the metric system. So the metric system is really going to be the most commonly used, and it uses a lot of prefixes. So it's going to use things like milligrams, decograms, micrograms, things you've probably heard your entire life, but now you will understand them, hopefully. And there are many instances when the stocked medication and the medication that is ordered are not the same. So you're going to have to do that dose calculation. And that's really where I'm going to teach you how to do those things. Now, it's really hard to try to do that on this video and have you understand it completely, because if I sat here and drew things out and you had to watch me do it, you would never pick up on it. So with that being said, we're going to spend some time in class doing this. We'll also learn how to calculate for pediatrics, because even though we use the adult doses for them, we can't do them the same way. We can't give a child an adult dose. So we'll be spending some time, quite a bit of time actually, I guess I should say, learning how to calculate dosages in class this week. So if you have a calculator, please bring it, otherwise your phone calculator will work. Alright, so chapter 54 really focuses on pharmacology and the study of medications or drugs. And it's going to include things such as, their forms, or the forms that they come in, the intentions for the use, and the effects of the medication. So drugs really are prescribed for several reasons, but it's important for you as the medical assistant to understand your role in providing medications or pharmacology. So really your job is to help care for that patient and help the provider give treatment. That could be things such as, administering medications, writing prescriptions and having the doctor sign off on them, calling in medications, or helping a patient understand what a medication is. That's really your role. Your role is not to actually prescribe or write prescribe medications. So drugs are really classified by 3 names. They're classified by their generic name, their brand name, and their chemical name. Now the chemical name you won't see very often. That's really just the chemical makeup of a prescription or of a drug. A brand name is what you'll probably more commonly know things as, because that's going to be the name that a manufacturer uses. For example, Prevacid. And that's really going to be written generally in capital letters, where the generic name is going to be the official name of the drug. So think back to when I just said Prevacid is the brand name. The actual generic name of it is Lansoprazole. And you can tell which one is a brand name or a generic name because a generic name will be written in all lowercase letters. Drugs are also classified into 2 broad categories. They're either a prescription or a non-prescription. A prescription is something that a doctor has to write, or a physician's assistant or a nurse practitioner have to write, and the patient has to take it to a pharmacy to have it filled. Where a non-prescription is an over-the-counter medication that a patient can just go into a pharmacy or a Walmart or a Target or a Schnucks and pick it up themselves. Okay? Now, there are different ways that we can administer medication. So some of those ways are oral, parental, sublingual, inhalation, topical, drops, and suppositories. I'm going to put it on you guys to understand what the difference is, and we'll talk about them in class, but I want to make sure that everyone knows how those medications are prescribed. Now, it's also important for you as a medical assistant. Like I said, you may be writing some prescriptions and having the doctor sign off on them, so you need to know how to read and write those. You also need to know how to read them so when you go to administer the medication, you know what you're giving or how you're giving it. So the prescription is going to be made up of a subscription, a superscription, an inscription, a signia, and then it's going to have the physician's name, address, telephone number, and DEA number. Now that DEA number is only going to appear on medications that are controlled substances. It's also going to have the number of refills or the dispense as written. Now that means that no substitutions can be given. A superscription contains a lot of the patient information, so their name, their address, their date of birth. Okay? An inscription is the name of the medication and the dosage. So you sometimes see it written and it says atenolol 50 milligrams. That's the inscription. A subscription is what the pharmacy is told on how to mix the medication or how much to provide the patient. So maybe we say dispense 50 pills. Okay? Signia is the Latin term for label, and that is actually instructing the patients how to take their medication. Alright guys, so that's really all I'm going to cover in this video for you this week. Please remember, as always, it is your responsibility to read the chapter thoroughly, or I guess I should say fully. You don't have to have a thorough understanding. I can answer a lot of those questions when you get to class. This week you will see an Angel what is called a lab activity. Please do not worry about that. We will take care of that in class this week. It's going to be the first activity that we do after our overview. So please don't panic and don't think you have to do something. We'll take care of that in class. Also, you have one discussion post this week, and that's really looking at the 7 rights of drug administration, which you can find in these 2 chapters we just talked about. And what I want you to do is look at those 7 and see if there's one that sticks out to you as more important than the rest. And if you feel that way, tell me why. If you feel that they're all equally important, tell me why. Now, after you've done that and you've looked at them, tell me what you think would happen if you missed a step. Maybe you missed one of the rights. What could happen? What are the potentials that could happen? Please make sure your initial post is due on Tuesday night by midnight and 2 responses on Saturday by midnight. Also this week, you will have the first half of your project due, so hopefully you guys have already been working on that, and once everything opens up, you can just submit your project. Alright, so here's your surprise for this week. You really have no written assignment. Yes, I know Angel says that you have one, but you're going to come to class on Wednesday, and we're going to do it together as a class. I'm going to help you with all of the answers. We're going to work together on it. Okay? That means when you leave Wednesday night from class or Wednesday afternoon from class, you will have no written assignment from me. You'll just have your project, and hopefully you've been working on that since I introduced it to you. So all you'll have to do is submit that. So that's your little surprise I have for you this week. If you have any questions about anything that you read in your chapters, bring them to me to class, and remember to bring a calculator, and we'll work on those calculations. Have a wonderful week, guys. I'll see you on Wednesday. Bye.